The newest Ebola patient in the U.S. recently returned from West Africa, where he treated Ebola patients as a member of Doctors Without Borders. On Thursday, Dr. Craig Spencer was rushed to a designated Ebola center in Manhattan after reporting a fever and diarrhea.
We've been preparing for months for the threat posed by Ebola. We have clear and strong protocols which are being scrupulously followed.
A team of disease detectives are now tracing Spencer's movement since he returned from Africa 1 week ago. Before his diagnosis, he rode the subway, went bowling, and stopped in a restaurant. Health officials have sealed off Spencer's apartment and quarantined his fiancée and 2 friends, but they emphasize that Dr. Spencer was not contagious until he became sick.
I think that the thing to make clear is that the first time that this patient had fever was today, and fever is the typical sign of a person developing contagious Ebola.
Meanwhile, new numbers from the World Health Organization indicate the current Ebola outbreak is the worst ever. At least 4,800 people have already died from the virus, and at least 9,900 cases have been recorded. But the WHO says the true numbers may be 3 times higher. Ebola has hit Liberia the hardest, with 4,600 reported cases and 2,700 deaths. And now news that more than half the treatment beds in the capital are empty. It's an unintended consequence of the government order to cremate all the bodies of Ebola victims. The order runs so contrary to Liberian customs that even more people are keeping their sick loved ones at home and increasing the risk of infection. Heather Sells, CBN News.